Yeah, so what we're doing today is we're doing interventional radiology, and that's a catheter. They're going to find a place to give me the catheter, and they put the catheter and they run it up to the mama tumor, and they bomb the shit out of it for like an hour or so with radiation beads. Then they take the catheter out, and the idea with the beads is that they dissolve in the tumor, and they go to the blood source that's delivering the cancer to the tumor, and they kill it. They just kill the source so it can't deliver anymore. And that's kind of what we're doing today.
And you've done it once before?
Well, let's see, the first one was week before Thanksgiving, 2018, and that went pretty good. It came as advertised. It did what it was supposed to do. But I had a mishap a couple of days later and ended up back in the emergency room for an overnight. I'd blown out the puncture where the puncture wound was, and I had a pseudoaneurysm going. So I was kind of like, not the same as when I went to do the surgery. And then I did a tour, and so here I am, and did the second one, and so I'm still my body's compromised since that first one in my groin. So my body's adapted to that, and that's cool. I know that they tore the soft tissue. That's what the radiologist told me. He had to get a little aggressive with my tumor because it was so big. And so the second one I had was about 3 weeks ago, and it was like an angiogram, but it was the same procedure. And because I lost weight between the first one and the second one, they gave me a light dose of it 3 weeks ago, and that was okay. I completely rested. I didn't have any mishaps after the procedure. So based on that, we're going back in today, and I think that we're going to be doing these every 6 to 8 weeks. That's what I think the plan moving forward is. Well, it's a lot of resting, and that's pretty much it, just flat out resting. And that seems to be what, and keep it clean and everything, keep the puncture wound clean, and, just, like I say, just get rest and take care of it, just go from there.
And then just tell me a little bit about, because weight loss is a big deal for you. Just talk a little bit about
so what's going on with that is, like, I have nausea today, which I wasn't having 2 months ago. So, for example, yesterday's nausea was I smelled my breakfast getting cooked, and that set off the whole chain of events. And then so that nausea is playing a part in it, and then also just loss of appetite and things like this. And so what I started doing was I got some nutrition on board. So I got some this nutrition to help me as I'm going through this. It's very good for me, and it's like a protein shake, and it's real clean. And so the nutritionist gave me some nutrition yesterday, some food, and I respond very well to that. My system does. It gives me energy. I feel great, and I'm looking forward to getting home when I go there later today and having one of those banana shakes.
And do you literally have to force yourself to eat?
Well, sometimes I do.
You say nausea, so you're barfing, right?
Yeah. Sometimes it's dry heave. Sometimes it's on the bathroom floor. Of course, my stomach's shrunk, so I get full. But sometimes I'll just sit with the meal for like an hour until I'm done with it. Just so I get the calories in, and so I'm eating. Well, and that was the other thing with the changes in my scan, and it showed an increase in the cancer and activity and so on, and that provided me weakness in itself, just with the the sickness or cancer growing. So that has a whole set of abdominal issues, which sometimes I don't feel like eating if I'm having discomfort, you know. So that's that. And when I take this medication today that they give me, I don't seem to have any side effects really from it, you know, other than trying to get it out of me, trying to detox from it, you know, drink water and just start getting stuff out of me. Well, see, where I'm in my head is like, so I got this little guy here on my phone. It's me in 1958 Christmas tree, you know, my little onesies, and that's my little guy. I get the take care of him. I look at him and he's full of, you know, wonderment. He's 2 years old, so it's 1.5 years old, I guess. And you know, I use that picture, that image of my little guy, just to go, cool, man, I'm going to take care of you today. And so where my head's at is I'm looking forward to this. I'm thinking that the surgeons and his staff tonight, or last night, got a good night's sleep, and they're ready to get cracking this morning, because I am, you know. But, you know, I realized that a lot of this stuff is out of my hands. You know, what I can do is take care of myself and suit up and show up, and then from there it's kind of out of my hands, you know. The surgeons and people like professionals I depend on from here, you know. That's kind of how I look at it. It is a change, and it's a little scary, it's a little serious. I go back to acceptance, you know, this is what I'm doing. It's I also, how I feel to a large degree is this is a huge form of self-care for myself. You know, it's just like a big thing that I'm doing for myself to stay on the planet. That's what I believe. And so in that sense, I'm you know, doing myself a favor, providing myself care.
Was it a difficult decision to make?
Well, it was my last decision to make, because there's no, you know, I started taking the chemo pills daily, and that was kicking my ass, and just, I started losing weight taking that, and just too many issues. I couldn't function really, and so I stopped taking it. And so, you know, they don't have a lot of, I don't have a lot with what I have in my kind of cancer I have, or the way it is in me. I don't have a lot of options. There's no operations, there's no switching livers, there's no, and I accept that. I get that. That's cool. So now that leaves me with different forms of treatment. And so that's kind of what this is. It's one of the forms of treatment. And but yeah, no, I'm looking forward to this. You know, I've done my bit. I've taken care of myself yesterday. I've been rested. I've been fed last night, and I'm following their instructions. And I'm counting on them to have done the same thing this morning when they come to work. So that's, you know, other than that, I'm looking forward to my day and having a good time while I'm here, you know. height of hospital fashion right here.
Now, would you classify that as punk rock?
I don't. It's a fucking why not? Everything's punk rock. So what we got going here is they drew a little bit of blood for me today. They got me hooked up to an IV, so I'm getting ready for my radiation delivery. that's what's going on here. They took all my vitals. I seem to be doing good. Hey, this is Stevie, and just here at Banner Health today. I'm getting ready to go get some radiation right now. I'm in my hospital bed, got my hospital gown on, and I'll see you in a couple of hours, okay? Today what they're doing is putting a catheter in me. They're running it up to mama tumor and delivering some radiation beads. I'll be lit up for 72 hours. Stay away from me. Even my cat, Potter, do you hear what I'm saying? Stay away from me. Anyways, I'm looking forward to doing this. This is part of my treatment moving forward. So it's a great staff here, and I'm good to go. We'll see you on the flip-flop.
Okay,
Yeah.
so make sure you're okay.
Yeah, thank you. I think it'll be good.
Yeah, alrighty. Okay, let me lock it. Okay. Don't miss us too soon, okay?
No, I'll see you around. I'll see you
Take
around.
care.
Thank you.
Okay,
Thank
bye.
you. Bye-bye.
Bye.
Welcome back.
All right.
Well, what do you think?
Well, I think good thoughts for the most part.
Was it a okay experience?
Yeah, it was fantastic. I don't remember much about it. I was, I got twilight, and the next thing I know, I was done. I am glad that I had that experience. Well, not. Yeah, I am. Well, here, let's put it this way. I learned something from the last one I had in the groin. Because right now, like today, I would be done. My friend would pick me up or something. We'd go out to lunch, and then we might go, hey, you want to go to a meeting later? And I just keep doing stuff because I'm feeling okay, when really I need to chill with, especially the first 48 to 72 hours on this thing, So I learned something, is what I'm saying.
Very cool.
Yeah. Hey, this is Stevie. I just want to let you know that the procedure went aces today. I'm good to go. Having a little Chipotle, get some yum-yums going, go home and lay down for a while. I got 3 days of bed rest ahead of me. But I'm feeling very well, and the doctors and staff are pleased with my procedure and everything. So, pretty cool. Thanks.